Okay, let me ask you a question. Is it better to get treatment and go into debt or die waiting for it?
It's better to get treatment and go into debt or die waiting for it.
Yeah.
Well, that's if you're.
I'm about to give you the cold, hard facts. So some of you might know that I do lives and I discuss, the NHS and state of health and social care, and I do this juxtaposition, the USA versus the UK with healthcare. And one thing I always talk about is the NHS waiting list. But I feel like people can't really grasp what it means, and they think I'm just grasping at straws and trying to find something to disparage the NHS about. But the truth is, the NHS waiting list is a much bigger deal than people realise. So let's actually compare how many people die on the waiting list in the USA versus the UK. Because obviously that's a big deal, and I've never heard anybody in public or online address this topic. I've got the numbers. Well, ChatGPT's got the numbers. So I've asked it, do a greater percentage of people die awaiting healthcare in the USA or in the UK? It says in 2022, 120,695 people died on NHS waiting lists waiting for hospital treatment. That was in 2022. The current waiting list for the NHS is the longest it's ever been in history. So it says 14,000 were associated with long wait times just in accident and emergency alone. Okay. Then we've got in the USA. So in the USA, there is a lack of insurance that's associated with preventable deaths, but only a small minority of people lack health insurance. But in terms of the number of people that actually died awaiting healthcare, which would mean died because they lack health insurance. So when you actually run the numbers, it works out that you're 13 times more likely to die awaiting treatment in the NHS than you are from not having health insurance in the USA. 13 times more. So the issue of waiting lists is more important than the issue of people not getting access to healthcare in the USA. Fact. Aha, but I know some people are going to say, well, what about the people that have health insurance that pass away due to waiting lists in the USA? First of all, that virtually wouldn't really happen because you're going to get the treatment if you have insurance. The delay would be caused by it not being approved, and, there's information on the screen to show you that. In addition, I also asked ChatGPT about this, and it said that it's a functionally similar thing because, again, the delays would only be caused for you, not because they have to prioritize somebody else before you in the waiting list, but because somebody else was prioritized before you because they got approved on healthcare, they paid for it, and they got the treatment. You wouldn't get the treatment if you're not insured for the treatment, and that's what would cause your waiting list delay, so to speak. So yeah, I think I've been pretty clear there. Okay, let me ask you a question. Is it better to get treatment and go into debt or die waiting for it?
It's better to get treatment and go into debt or die waiting for it.
Yeah.
Well, that's if you're that debt option is an option.
It is an option. That's what medical bankruptcy is.